You just felt a pop or a snap in your foot and ankle during a game, match, practice, whatever. Now these can be a scary few seconds, so let's break down what the most common snaps, crackles, and pops are in the foot or ankle, and when or when not to be worried. All right, number one, and probably the most common I see in my office, is a plantar fascial rupture. This pop is usually felt right in the front of the heel bone, where the bottom of the foot becomes soft, and usually on the medial or inside of your foot. You know, we think of plantar fasciitis as this like searing hot pain in the heel, and more often than not that is the case. But there are a lot of people walking around with significant disease in their plantar fascia who don't have any pain, and as a result of that can work that band of tissue that helps hold up your arch up to the point of failure or rupture, and up to the point there, they had no idea anything was going on. Then there's the other people who are just playing through that searing pain all the way to failure. Now, plantar fascial rupture typically is partial because the plantar fascia is actually 3 bands. So it's usually that medial or inside band that'll go during one of these pops or snaps. And so if this happens, what do? Drum roll, please. Nothing. Just congratulations, you just performed your own surgery. And I don't mean that sarcastically, this is exactly what we do in surgery for long-standing fasciitis. Actually, I came up with a common technique we use today. It's in this paper right here. But yeah, all we do is go in and release the fascia, which translates to tear it. So oftentimes when someone tears it in the wild, it hurts a lot when it happens, but then after a short amount of time, it feels better, and the only thing limiting play is the inflammation from the energy of the tear. So once that subsides, go. Have fun. All right, number 2 is one that can actually mimic some pretty dangerous injuries, and that one is called a plantaris rupture. This one is usually felt right along the Achilles tendon, right in the mid-substance, or maybe sometimes closer to the knee. And you may or may not know this, but there is another tendon that runs almost the exact course of the Achilles tendon. It even starts above the knee like the Achilles, and that's the plantaris tendon. And it's a pretty, I guess useless is the right word to describe it, tendon, and depending on its course, length, and position, during movement can rupture, which feels and sounds a lot like an Achilles rupture. And if the rupture is very low energy or partial, it can actually mimic a blood clot. So no matter which way you swing it, this little tendon can cause some pretty big concern. The good news is that plantaris ruptures really don't need much treatment. Typically, I'm just treating symptoms in these ones, and so once the pain is gone, you're kind of good to go. The biggest risk with these, like I said earlier, is that they mimic other more nefarious injuries. So sometimes it's actually the diagnostic process that's the most annoying part of these injuries. Because, if you're an athlete and you're going through all this diagnostics to make sure you don't have something major going on, and it ends up being something small, you kind of wasted a lot of time. The good thing is you don't have to waste any more time usually on the treatment process, maybe just a little. And number 3, I put this in here because I actually do see this one constantly in my office, and it does cause people a lot of anxiety, and that's a simple joint or tissue crack. And I don't mean a crack as in like a break or a fracture, I mean it as in like a, joint crack. These can be felt pretty much anywhere, unfortunately, which is why people sometimes get pretty concerned over them. And the most common cause of this is a pressure drop in a joint from stretching, but it can also be a result of adhesions, like soft tissue adhesions, or bowstringing of soft tissue, or even just some joint surface irregularity. But overwhelmingly, these are completely harmless, and although can be quite loud, they don't really affect much of anything. Number 4, woof. Achilles tendon ruptures. And I'm sure a lot of you know these are felt right above the heel bone, right where the Achilles feels like a bowstring, which is where we call the mid-substance. Now, sometimes you're gonna get lucky and it's a partial rupture, in which surgery isn't always warranted. Sometimes they tear directly off the heel bone, other times it's a rupture in the middle of the tendon, which is kind of like the more hallmark injury you see, or the one you've been seeing kind of all the time now in the NBA and honestly in other sports now too. Now, of course, total ruptures are rough. There's just no getting around it. Immediate surgery is the fastest route to full strength, but even then, you can be looking at a year before trusting that thing. And with non-surgical care, you're right around the same time frame, maybe a bit quicker time frame, depending on how fast you can get an MRI or a surgical consult. But you might not be as strong of a repaired tendon versus if you have it like actually repaired surgically. And honestly, Achilles tendon ruptures and rehab, it's a bigger topic than this video. So if you want to dive deeper into this specifically, I have a whole video on it that I'll link at the end of this video. But I would say if you suspect this injury, the best thing you can do is have an expert take a look at it as soon as humanly possible. All right, moving on. This next one is close to the Achilles, but it's actually a much easier recovery, and that's what's called a tennis leg. And this one isn't just caused by tennis, it's caused by just about any sport, but this one's felt right in the back of the calf, like kind of just below the knee. What happens in this case is that the medial head, or the inside head of the gastrocnemius muscle, which is one of the muscles that makes up the Achilles tendon, tears. And these ones are almost always treated non-surgically and take anywhere like in 3 to 6 weeks to get back to full use and strength, just depending on how diligent you are with your physical therapy. All right, next one, I think we're on number 6. This one can either feel like a pop or a snap, or sometimes feel like a squish, which I know is kind of weird, but I've heard from several people, independent of each other, that they felt a squish when this happened too. And that's a sesamoid ligament or sesamoid complex rupture. And for those of you that don't know, right underneath and behind your big toe joint are two small round bones. They are called the sesamoids, and they help keep your big toe straight. And these two round bones have an enormous complex of ligaments and joint capsule that goes around them. And they participate in a lot of very complex movements, and as a result of them, when you hit them the right way or move them the right way, they can rupture. And these are felt, like I said, right under the big toe joint, and usually happen during a pretty violent forefoot push-off. You could land on a plantar flexed forefoot, or during forced hyperextension or dorsiflexion of the big toe. Usually that's under load. Usually you see that like sprinting or jumping or a quick directional change. The other thing this can happen is when you're trying to push off while being tackled, kind of like in American football. And these are most commonly treated with a walking boot and physical therapy to make sure that big toe joint gets moving again so it doesn't scar down really hard. And that can take anywhere like 6 to 8 weeks to fully heal. It can actually take a little bit of time. Orthotics and shoe modifications are also great for these after the fact. If you want to learn exactly how to modify your shoes or insoles to protect against persistent big toe injuries, or really any other injury that you can think of in the foot and ankle, check out my shoe customization and lower leg taping ebook right here for more info on that. I'll leave a link in the description below. Now, in some extreme circumstances, you will need surgery for these, but that is only if there's significant retraction of those bones, those sesamoid bones, or persistent instability of the joint. But like I said, that's not super common to actually need that. Make sure you get an expert evaluation before deciding on that. All right, this next one I've had some intimate personal experience with, and that one is an ankle sprain. Now, typically to feel or hear a snap or pop, you actually need to at least partially tear a ligament. So if someone says they heard something when they sprained their ankle, I usually figure that's at least a grade 2 sprain until proven otherwise. And this one will get felt right smack dab on the outside of the ankle. Typically, these take around 6 weeks under good circumstances to heal and are mostly treated non-surgically with just a boot and physical therapy. But if the ligament is completely torn or the spraining becomes chronic, as in it's happening routinely and the ankle now feels unstable all the time, then surgery starts becoming a bigger consideration, especially now, considering we have such good techniques for ligament reconstruction. All right, I think we're on the 8th one now, and this one is probably the most subtle pop you'll hear. It's kind of more like a thud. And this is when your peroneal tendons pop out of their groove. In fact, the syndrome is actually called popping peroneal syndrome. And this one is felt right on the outside of the ankle, a little bit more towards the back than an ankle sprain would be. Now, what happens here is that when the ankle is suddenly everted and dorsiflexed, the tendons on the outside of the foot and ankle, or the peroneals, can rip out of their groove and rupture the retinaculum, or the outer strap that holds the tendons in place. And the way I always saw this injury is somebody taking like a lasso or a whip back. Like that's the action those tendons take, and sometimes those restraining structures, those straps on the outside of the ankle, just can't handle it. I know this probably looks ridiculous on camera. Now, if some of those restraining structures or part of that strap is still intact after the injury, then typically you can just wear a boot for 3 to 4 weeks and then begin physical therapy. But the crux of this is getting those tissues to actually scar back in and hold the tendons in place, so then afterwards you can effectively rehab them. And the thing is, it's usually possible to get that thing to scar back down, but if it isn't, or the subluxing or popping becomes chronic and the tendon just loses all of its mechanical advantage, that's when we start talking about surgery to rebuild that tendon pulley complex back to where it can actually fire, stabilize, and push the foot. All right, next one up is the one that everyone kind of seems to worry about when they twist their ankle or foot, and that's an ankle fracture or a Jones fracture. Now, obviously you can have other breaks besides these two, but these ones are the most common I see in sports and just the most common that kind of run through my clinic. Now, both an ankle and a Jones fracture are usually felt on the outside of the ankle, although you see a lot of ankle fractures, you feel them on the inside too. It just depends on if the ankle fracture has enough energy or, where it was twisting. Now, ankle fractures, if isolated to one bone and that bone hasn't moved at all, can be treated just with a fracture boot. But if there is any instability or there's multiple structures that are affected, then surgery is usually warranted just to protect the joint from long-term harm or protect it from what we call post-traumatic arthritis, which can sometimes just be worse than the break. But aside from ankle fractures, Jones fractures are breaks in the fifth metatarsal on the outside of your foot. And specifically a Jones-style fracture or breaks in that fifth metatarsal right where the blood supply to that bone is weakest. So these have a really hard time healing. And for that reason, these are typically either treated with a bone stimulator if you're not going to be treated surgically, or with surgery to give the blood supply the best chance of reconstituting. Typically, this is 6 to 8 weeks in the surgical recovery process, another 6 to 8 weeks to rehab to full strength to return to sport. Although in both of these instances, both these fractures, there are people that can get it done sooner. All right, next up is the dreaded one, the Liz Frank injury. Now, a Liz Frank injury is named after the person that, discovered it or, described it. And this one is felt right smack dab in the midfoot. And this one is where the keystone joint in the middle of your foot basically just gets torn or pulled apart. It usually happens when you twist or jam your foot while it's pointing down, like landing wrong from jumping or getting your foot stuck while turning. And I gotta say, these ones are incredibly difficult to treat because they make the foot so unstable. So they honestly can look like not a lot on x-ray and then end up needing like significant surgical repair. And I've unfortunately seen a few people refuse surgery because it seems like overkill to them, and then end up with a foot the size of a football that can't function properly afterwards. Because what will happen is right after the injury, it'll look swollen, but it won't look that bad. But then the long-term consequences of this, because it's so unstable and the grinding of those joints, will basically make the foot look like it is stepped off, almost like there's a diving board then it goes into the pool. And more than just the look of the foot, Liz Frank injuries in terms of function after them, if they are not treated appropriately, your foot loses just about all of its function. Because instead of bending at the ankle joint where it should and the foot is staying stable, it's now bending at the ankle joint and then bending at the midfoot too. So it's just like becomes this loose bag of bones. And so even more than an ankle fracture that's not treated appropriately, a Liz Frank basically just destroys all function in your foot. So I know it might seem alarmist in the beginning, like, hey, it's just this little ligament that got pulled or popped. I'm telling you, those are the ones where people have the most issues afterwards, bar none. So yeah, I know it might sound alarmist, but the thing that you can do to protect yourself the most is early intervention. And I would say by far the most gruesome pop you can feel is what's called a subtalar dislocation or a basketball foot. And that is when the foot actually dislocates on the joint right underneath of the ankle, and the ankle bone ends up popping or rupturing right through the ligaments on the outside of your foot, or sometimes it can happen on the inside of your foot. This one, thankfully, is exceedingly rare. It's actually very hard to do this. Your foot has to be in just a perfect position. Usually you're falling on something, like you could do it while hiking and falling from a height and coming down on a rock or something. Usually it's bad. I call it a basketball foot because it happens when you come down on someone's foot. But it's, like I said, it's exceedingly rare. Those ones, those are immediate surgery. I mean, those ones are actually limb-threatening injuries sometimes because it can affect the nerves and the blood vessels. So thankfully, those are very, very uncommon, but put it in here just for completeness. And of course, there are other injuries that can happen, but these are the ones that are the most common. And like I said, if you do want to take a deeper dive into why the biggest NBA stars all get immediate Achilles surgery after ruptures, and if that course of action might be right for you, check out this video right here. I'll see you in that one.